Hi, my name is Angela Fellers-Lemire, and I am the nurse consultant for the Women's Wellness Connection program. Today, I'll be reviewing aspects of the clinical concordance policy within the WWC program. So what is clinical concordance? Clinical concordance is determining when a patient with an abnormal CBE has had appropriate follow-up and is no longer in need of further diagnostics. This most commonly occurs when an abnormal CBE ends at a BI-RADS-1 or a BI-RADS-2 mammogram result. WWC recognizes that there are cases in which a woman with an abnormal CBE is sent for diagnostic imaging and only a mammogram is completed by the radiologist. Although the radiologist may consider his or her diagnostic workup complete, this does not mean that the clinician who found the abnormality should consider the workup complete. If the imaging results do not explain the abnormal CBE or are disconcordant, the patient should be referred for further evaluation. Also, ECAST will not automatically close a clinical cycle for payment when a CBE result is entered in ECAST as suspicious for cancer and only one mammogram was completed, screening or diagnostic, with no additional diagnostic procedures or a repeat CBE documented. Let's talk about the options for reaching clinical concordance in these cases when a diagnostic ultrasound is not completed. There are two options. You may repeat the CBE within 30 days and have the provider compare it with the imaging result, or have the provider compare the imaging findings with the abnormal CBE documentation and ensure that the abnormality is explained by the imaging. So if this happens, please let the nurse consultant know that the patient's provider has reviewed the case for clinical concordance and recommends no further follow-up of the abnormal CBE, or a repeat CBE to assess the abnormal finding has been recommended to the client. The WWC nurse consultant will then approve the cycle for closure and payment. An abnormal CBE in the presence of a BI-RADS-1 or BI-RADS-2 ultrasound does not require further investigation. The recommendation is routine screening mammography in 1 year. For BI-RADS-1 and BI-RADS-2, in which the mammogram is completely normal or the finding is benign mammographically, the recommendation is routine screening in 1 year. In review, if a BI-RADS-1 or BI-RADS-2 mammogram result follows a symptomatic CBE, ultrasound is highly recommended. If an ultrasound is not completed, there are two options to reach clinical concordance. Have the patient return for a repeat CBE and provider comparison, or have the provider compare the imaging findings with the suspicious CBE documentation and ensure that the initial abnormality is explained by imaging. If you are a CCGP or Care Coordination Grant Program agency, you are encouraged to follow the same evidence-based guidelines that are followed for WWC clinical services, including the clinical concordance policy.